welcome to Labor and Health, gentlemen. Go ahead and introduce yourself and tell us what you got to tell us.
Thank you, Mr. Chairman, members of the committee. I'm Josh Hannes with the Wyoming Hospital Association.
Mr. Chairman, Eric Boley, President of the Wyoming Hospital Association. I'm going to, if it's all right, Mr. Chairman, we're going to tag team this a little bit. And Josh has been working closely with a coalition of folks that are interested in this topic. We've been working on this, obviously, since Medicaid expansion became a possibility. And I think a lot of really good questions have been asked today. And we hope to provide that information to you. Senator Rothfuss did a great job walking through the bill. There are a lot of topics that we've covered, and you'll probably have more questions and answers by the time we're done. And I think in the interim, we can help really do some education on FMAP and some of those things. But with that said, one of the questions was the poverty, the level of income to qualify for this. When we looked that up, we think it's right around $24,000, and that's for a family of two. The other thing that we'd like to share with you is we're talking about numbers is I think estimates show that 76% of the population that could be captured under Medicaid expansion are single mothers with two children. We talk a lot about the working poor, and there are a lot of folks out there that are working for low wages that don't qualify because they don't make enough money to qualify and be able to get any help with the exchange, nor could they afford the premiums. And they would fall in this category where they could have coverage. And I think we can talk a little bit about the importance of that coverage. I'm gonna let Josh jump in here if that's okay, Mr. Chairman.
Thank you, Mr. Chairman. So as Eric said, coverage is a major component of having access to care. And in Wyoming, there is a population of people for which there just is not an option. There's not a pay source that they can tap into. And so what you'll see happen, and Senators Baldwin and Bouchard, you've been down this road with us many times and heard this, is that when people don't have access to primary care, the front door to the medical system becomes the emergency room, which is an inappropriate place for care and a wildly expensive place for care, particularly if you're uninsured. What expanding Medicaid does for this population that doesn't have another option is changes their ability to access healthcare in the right place and at the right time. Now, obviously, there are long-term positive health effects of having that access, but I'd also turn your attention to the Department of Health's report, which provides or which states to their study that you could potentially see decreases in the individual marketplace by expanding Medicaid from 5 to 15%. That's not guaranteed, it's an estimate, but it is another downstream effect of providing access to these folks that would impact costs across the healthcare system throughout the state. Now, again, and most of you have heard this, is that hospitals in Wyoming take on tremendous amounts of uncompensated care. So care being provided for which they're not reimbursed. And that number is typically in most years right around $100 million, sometimes a little higher, sometimes a little lower. And so what are the impacts of that? So every dollar that's spent covering uncompensated care is money we're not investing in equipment. It's dollars we're not investing in new physicians and providers. It's money we're not investing in updating and maintaining our physical plants, some of which are aging considerably. I would add that, like Senator Rothfuss said in his presentation, that states that have expanded Medicaid have not turned it away. There's a reason for that, and there's a number of positive effects that states see to their state's budgets and to people being able to access care in the appropriate place. The argument has been, or a argument has been, that Wyoming can't afford expansion. I think it's been demonstrated today that there's an opportunity now where we can afford expansion. And I think it's still the right thing to do. And I guess the final thing I would say is, again, to Senator Rothfuss's point about, if not this, what else? And I think some of the absence of an alternative plan is because of the quality of this plan and what it brings. I know there's some pushback to expanding Medicaid and creating coverage for for this population of people, most of whom are working, most are women, most have children. This is an important policy that has positive effects across the spectrum of healthcare. And I think it's time that we move forward and advance this policy for people in Wyoming.
Mr. Chair, a couple other comments, and Josh done a great job. I think one thing we'd like to clarify is we talk about the $100 million worth of uncompensated care that's given away annually. That $100 million isn't based off our charges. That's the actual cost of delivering that care. So charges are much higher. We're not even into that. We just want it to be clear that that's the actual cost of delivering that care. A couple other things that I wanted to touch on, and I think this goes back to Senator Furphy's question, is what happens if after 2 years we fall below the FMAP and we back out? We believe that we have folks out there that need to have care, and they're not seeking that care right now. So when they finally do come into our hospitals, when they finally see the doctors, they were sicker than they should be if they had coverage. And so what we believe will happen, and what we've seen happen in other states, is folks that don't have coverage will now start seeking coverage. They'll seek coverage in appropriate places. We can help them manage their chronic diseases and their illnesses, and we can get them on a healthier path in life, which in the end costs everybody less money, and we have a healthier population. The argument that's been for 7, 8, 9 years is, what if the federal government backs out on us? And we have turned this down for years because we keep saying the government could change. The government's invested in this. The government is part of the ACA, and we continue to turn our backs on this opportunity to take care of our neighbors. We've given up millions and millions of dollars, and you know, one of the questions was about where the pay for this came from. We are paying for it. Our industries are paying for it, but we're paying for it in other states. On top of that, healthcare professionals across the country took cuts in their Medicare reimbursement when this was originally started to the tune of $155 billion so that other people could have coverage. And so the pay-fors are there. We've already paid for a lot of this, but we haven't reaped any of the benefits and made sure that folks have coverage that they need. And so I think that our concerns about the feds backing out is really unfounded, and it actually, we're showing an increase in their desire to help make sure there's coverage for this population. I think the final thing that I would say, and then we'll answer any questions that you have, is my belief, our belief, is this is not really giving a handout to people. This is giving them a hand up. As we look around our state, as we look at what's happening in some of the communities we hold dearest to us, we have folks that are losing their jobs now because of the downturn in the economy, things that are happening in the oil and gas industry, the coal industry. We're dealing with a different population than we were 7 or 8 years ago, but these are our neighbors that don't have coverage right now, don't have health insurance. This would give us a chance to help them have coverage until they can get back on their feet. And we think it's the right thing to do now. We've thought it's the right thing to do for many, many years, and we would ask you to advance this out and see if we can do something to help our neighbors. With that, we'll answer any questions.
Questions for the Hospital Association Committee?